3, 2, 1.
Good afternoon. I'm Dr. Tina Jessee with Good Sound Audiology, and welcome to our Good Sound Happy Hour. We have a very special guest today. This is Dr. Erica Williams, who is from ASU, and she's going to talk today with us about the program there and what she does and the wonderful students she gets to work with. So thank you all for joining us. We are actually in Mesa right now, but we have 3 locations, and hopefully you guys are at home. You have your bottle of wine or your glass of wine, and you can hopefully get some really great information today and enjoy a glass of wine with us. Again, I'm Dr. Tina Jessee from Good Sound Audiology, and this is our Good Sound Happy Hour. So we typically, Dr. Williams, try to start off talking about our wine.
All right.
Now, I have to tell you.
Just stop. You're not even on yet.
Okay,
Just
perfect. Oh, sorry.
Just look.
Okay.
Just look pretty.
Okay, well, you got to pay me more for that.
I do not see it.
Does it usually take that long? Sorry, we've not had that happen before.
Because it's saying live, we're building an audience for you. Keep going. We're telling your followers to join your video.
Yeah, but I'm not getting any notifications, so if I'm not, no one else does.
Okay.
There you go. Now you're live.
Okay, hi, good afternoon. I'm Dr. Tina Jessee with Good Sound Audiology. Welcome to our Good Sound Happy Hour. We are actually in Mesa today, but we have 3 locations, and hopefully wherever you are, you're comfortable, you have a glass of wine. Today we have a very special guest. This is Dr. Erica Williams from ASU. She's going to talk to us today about the program that they offer and the services they provide, and she'll also probably talk to us a little bit about the students, the type of students they're looking for to come into the field of audiology. We usually start this off talking about the wine,
Okay.
and what I was going to say was, for my wine experts out there, you're going to have a good time with this because I'm sure I'm going to mess this up. This is actually a wine I'm not familiar with. This is a Riesling, and you like Rieslings, correct?
I do.
Yes.
That's correct.
So you'll have to tell me if it's a good one. I am not a Riesling fan. However, I do like trying new wines and finding wines that I typically don't like and then finding one I do like, so then I can order a little more intelligently. So I hope it's a good one. It's ranked very high, so I don't know if you guys can see. This is where I'm sure my wine experts are going to say, oh my gosh, this woman doesn't know how to speak. But it's from DR Lucen Estate in Germany. It is supposedly very highly ranked. It is in, is it Moselle? Do I have any Germans out there to help me with the region, Moselle? If I'm so sorry if I'm shredding that. So it is, again, 100% Riesling. Rieslings are usually a little sweeter.
Yes, they are.
Yes. So let's see. I've got other good information. 8.5% alcohol. And it looks like, again, yeah, I mean, it's rated pretty high. So let's just, cheers, welcome, and we'll give it a try. And again, thank you so much for joining us today.
Glad to be here.
I'm going to set that up front, so if we love it, we'll tell you to go buy it. But, so if you like Rieslings. So it does, to me, taste like Riesling. It's a little sweet.
Yeah, it tastes
Yeah.
great.
But smooth.
I like it.
Do you like it? But smooth?
I do.
Yeah, I could drink that. Yay.
I've had more California region Rieslings, but
Have
I like
you?
this one quite a bit. Yes.
When I go to California, I've only gone to one wine trip in California, and obviously we did a lot of Cabs and a lot of Chardonnays. I don't think I did any Rieslings. There is Elena's trying to tell me something.
Put the bottle back.
Oh, sorry. Okay, sorry about that. All right, there we go. So I guess we were blocking our view. Okay, so Dr. Williams, tell me a little bit. You've been at ASU how long?
A little over 3 years now.
Oh,
Or
okay.
working there a little over 3 years, but I did all my schooling there as well. So.
Really? So are you a native?
I've been here since I was 6, so not quite, but everything I remember at this point.
You're almost a native. That really counts as a native. And what are your responsibilities at ASU?
So currently I teach courses.
Okay.
I supervise students in our clinic.
Mm-hmm.
I coordinate all of our off-campus placements
Okay.
and fourth-year externship placements. And I advise our Student Academy of Audiology club.
Okay.
And then other departmental responsibilities as well.
And ASU also has a clinic on site, is that correct?
They do. We have an on-campus clinic. So it's a speech and hearing clinic, so both the SLP program, speech-language pathology program,
Right.
contributes to the clinic, and then the audiology program contributes to the clinic as well.
Okay, excellent. For those of you who are just joining our happy hour, this is Dr. Erica Williams from ASU. I'm Dr. Tina Jessee with Good Sound Audiology. If you are joining us today, I'm going to ask that you like our event and share it. Share it with your friends. We've done this 3 or 4 times now, and really, it's been such a pleasure. Actually, every time we've done it, I've learned quite a bit and walked away really pleasantly surprised with what I gained from it. And we've had such great feedback from our patients. So hopefully you will all feel the same today and like and share the event. Your clinic, or I get it is called a clinic, right?
Yes,
the clinic
yes.
that's on site. Do typically the audiology students, do they do their first rotations there, their last rotations, or does it just vary?
A little bit of both. So their first semester they observe in the clinic, and
Okay.
then their second semester that summer, and then the first semester of their second year they are in the on-campus clinic.
Okay.
So that's where they start their training
Okay.
in the on-campus clinic.
And the services you provide, hearing aids?
We do diagnostic testing, we do hearing aids, assistive listening devices, we do ABR testing, we can do vestibular testing.
Wonderful.
We have oral rehab groups on campus, so it's really a comprehensive clinic. We do APD testing, we do tinnitus evaluation.
Okay, so see right there, I already learned something. I did not know that you guys did auditory processing disorder. Do you do the evaluations? Do you do the treatment?
We do
Both?
evaluations, so it's a joint evaluation between speech and between us.
And most of those cases that you see, are they pediatric?
Pediatric cases.
Yeah,
We do see
okay.
a few adult cases mixed in,
So,
but mainly pediatric.
Again, right there, I already have a great takeaway because I didn't know that. I did know you guys had a clinic. I knew you were doing some hearing aid services and some vestibular work. We had one of our happy hours a few months ago was actually talking about vestibular work
Okay.
and things like that. And people are always they come to my office, they get referred, and they're like, why are you checking my hearing? I have vertigo. And so we had talked a little bit about how that's all connected, and often they will start with an audiologist, or at least hopefully early on. Again, for those of you just joining us, I'm Dr. Jessee with Good Sound Audiology. This is Dr. Erica Williams, who has been kind enough to drive over this afternoon and share her experience with us and give us some great information about the Arizona State University program. If you're joining us today, please share and like this as much as you can. I wanted to talk to you. I take students from really all over the state, and I've taken several of your students. And it's interesting because it is interesting because I see your students really all have a certain personality. Did you know that?
A similar personality to one another.
They have certain strengths compared to the students I take from another program. They have a completely different set of strengths. But I can usually, like, if let's say I had a student, I didn't know where they were from, I would know within a week if it was an ASU student or an AT Still student or a U of A student. Do you know what I mean?
Yeah, that doesn't necessarily surprise me because I'm sure they're all, we certainly have our things that we focus on in our program, and they're all getting the exact same coursework within our program and going through our clinic in the same way, where I'm sure another program would approach things slightly differently.
Yeah, have other things they're focusing on. But yeah, it is interesting because there's definitely some characteristics that I see in this group of students versus this group of students. What would you? So the other I wanted to mention to probably a lot of our patients just really don't know the training and the requirements to become an audiologist. I could speak to that, but I'll let you. Do you want to speak to that a little bit?
The current qualifications are, it's a 4-year AUD program. So that's a post-bachelor's program, so they go through and get a bachelor's degree, and that's a 4-year clinical doctorate program. And when they come out of that, they've gotten, a comprehensive coursework battery in addition to comprehensive clinical training. So in our program, they need to have at least 1,820 hours of, patient contact hours to be able to graduate from our program. So that's, they come out well equipped by the time they're done.
You mean they didn't do a 6-week training program at Costco?
Sure did not.
So I'm curious, when you say they have over 1,000 hours of clinical time, that means patient hands-on?
Patient time that does include documentation and such, because that's certainly an essential part of learning how to perform patient care, is knowing how to document what you've done and such as well.
Correct.
Which is just as important.
Is that a norm for all programs, or do those numbers vary?
I can't speak to what exactly every program has,
Okay.
but given that 1820 is the minimum number to be certified by ASHA,
Okay.
that's a pretty common number to abide by.
Okay. And ASHA is the American Speech and Hearing Association. There's several national programs that credential us as audiologists, and then I think it's a little bit different when it's a program being credentialed as well.
Right. So not all people choose to be accredited by ASHA when all is said and done. However,
Right.
that's
But I think most programs,
that way we
college,
give our students the option to be able to do that when they
yes,
graduate should
yes.
they choose to.
So obviously, again, I talk to students now, and you're a little bit younger than me, but I was lucky. I started off in this field. I did my bachelor's in communication disorders, so that was 4 years. I did my master's in audiology, so that was 2 years. And then I did my fellowship, so that was a year, 4, 5, 6, 7. And then I did a 2-year doctorate program, so it's 9 years. And it's funny because I had one of your students here the other day, and we were walking a patient out, and the patient was like, so you're going to change your mind? And we're like, no, she's 6 years in. Like, I doubt someone's going to change their mind at this time. And this is, Megan, who's been an excellent student. So I would kill her if she changed her mind because she's going to be great in our field. So, but yeah, I don't know that people really realize the work and the requirements that are expected from these students coming into our field. How long has ASU had an AUD program?
We've had a program since 2004.
Okay. And does your program size remain stable? Do you want it to grow, or do you really want to keep it at a set size?
A little bit of both. So since that, so our first graduating class was in 2008.
Okay.
And at that point in time, our program size was about 25.
Okay.
Where now we are up to about 50 students
Wow.
total across 4 years in our program at a time.
Okay,
So
and that's just for audiology?
Just for audiology.
Okay.
So, 12 to 15 students a year. We don't choose to grow, we have about 100 students apply each year for the program, and we don't choose to grow much larger than that for the reason of we want to make sure that we can provide, proper training to each of the students that we admit.
Okay.
So we do limit our growth to some degree.
So you
so
had
that we
over
can
100
provide.
applicants.
We had over,
And
yeah.
you accepted how many?
Well, this year I believe we had 93, so it
Okay.
varies year to
Right,
year, but
sure.
we have close to 100 each year.
Okay.
And we end up with a class size, of 12 to 17.
Wow. So it is very
It
competitive.
is very competitive.
Yes.
But we choose, to make sure we can provide proper training to all the students we admit.
Right.
So we don't overextend ourselves either.
So, I think a lot of people know that audiology is a great profession to come into. I mean, there have been things printed. It's low stress. The pay is hopefully decent. It's very rewarding. I mean, giving better hearing, I don't know that it gets any better than that. Obviously, we're probably very biased. It's emotionally rewarding, financially rewarding, and yet it is competitive. And I know that about all of the programs. And even, I think, I'm familiar with some of the programs, even in the Northwest, and it's the same thing. It's really hard to get in. But I think that also speaks to you. You do want to be able to provide a quality education.
Yes.
And, because again, you have to have placements for all those students.
Well, we're very conscious as a faculty of making sure that we're providing, quality classes and quality education for our students.
Excellent, excellent. So for those of you joining us today, if you can, click the like box and share this. If you don't mind sharing this on your Facebook page, I really want to make this valuable for as many people as possible. We will be captioning this event and then having it up on our website in a few weeks, and then we can share this link with you, and you guys can use it however you would like. You're very welcome. I am curious, when you're accepting students into the program, so again, you have 90 or 100 applicants, you're going to take 12. What are you looking for?
So,
in 3 words or less. No, I'm
not in
kidding.
3 words or less. So, initially they provide a written application to us, and we review that and their GRE scores and their GPA and such and their letters of recommendation. And then we invite about 30 or 40 to come in for an interview.
Okay, so you rule out 60
So
right off the bat.
Right off the bat.
Okay.
And then they come in for an interview. They take a short written test that, of novel questions that they haven't seen before.
Okay.
Just to get a writing sample and such. And then they have an in-person interview with at least 3 different faculty members while they're there.
Okay.
And so we're looking for people who, people who tend to get accepted are people who have had, some sort of exposure to audiology, so they've done some sort of, observations or things like that they know what the field involves. Someone who has good communication skills, and things like that are, the people who make the most promising candidates. And then we offer to a certain number, and obviously some people choose to go elsewhere.
Sure.
And so we end up with our class sizes of 15 or so when all is said and done.
Is there a preference given to someone who has a bachelor's degree in the sciences, or is that? We need
to make sure that people have the proper prerequisite courses before they come in.
Okay.
So
if you have a bachelor's in marketing,
you need to have some prerequisite courses before you come in. So it doesn't necessarily matter that that's what your bachelor's.
So you would have to take other courses before you would even apply.
You'd have to, yes.
Okay, because I wasn't sure how that worked. Again, I was lucky. I started off, and I don't know that everyone did that or does that, but I was just very lucky early on. So I wasn't sure how, because I've had a few students who weren't even in the doctorate program yet, and they've reached out and said, can I just come sit in your office? Can I do anything to get in so that when I want to apply for my doctorate program, I look a little stronger? And I know often they've had a degree in something completely different.
I think it might vary by program and how they handle the prerequisites.
Well, it makes sense, though. If it's that competitive, I think, clearly,
the more exposure you have, the better.
Exactly. The more exposure you get to some type of our science and whatever's, it's got to be, I'm sure it's weighted in to some degree. You take students, so let's talk a little bit about first year, second year, third year, fourth year, because I know this is a really extensive 4-year program, and they've changed it and really modified it to really make it as strong as possible so that our new graduates coming out are as ready to practice as possible. I remember when I came out a year or two ago, many years ago, I remember thinking when I got into the real world, oh, my program, and before OU hates me, give me a second, I'll finish before my supervisors and my old mentors start texting me saying, I can't believe you said that. But when I came out, I remember I felt so not ready and not prepared. And then when I moved to New York City and I started, actually after 2 years, I was taking students, and I remember taking different programs, and I felt so much more prepared, because then I actually realized how great my program was. That's what I was getting to. But I don't know that when you first come out, you feel,
You never feel completely
You
prepared.
never feel completely ready. And that was kind of my learning experience from that. But I do think, obviously, as in any field, there are programs, some are going to be stronger than others. And I think, again, just speaking to the competitive nature of our field, I take students from all the programs, and it's amazing to me, we really get some great people. It's been years since I've had a really poor student. Years and years and years. So anyway, for those of just joining us, I'm Dr. Jessee, Tina Jessee with Good Sound Audiology, and today we're speaking with Dr. Erica Williams from Arizona State University. Thank you so much for joining us. I hope you're enjoying a glass of wine or water, whichever you prefer. Let's talk a little bit about those 4 years. Kind of what are they doing? Talk me through that.
So during the first year of their program, during the first semester, they observe in our clinic, and then to prepare them for when they're going to be in the clinic the next semester, and then they take classes.
Okay.
And those are the classes that are designed, to be the basic audiometry class, the hearing aid class, that are ready, the foundation that they need to be ready to go into clinic. Then that spring semester is when they are in clinic for the first time in our on-campus
And when you say clinic, you mean they're seeing patients with the supervisor?
With a supervisor, yes. So they're always with a supervisor,
right.
But that's when they're seeing patients in our on-campus clinic. And they're still in classes every semester, of course.
So they take classes part of the day in the evening, and then they're seeing patients?
They take classes on 2 days, and then they're in clinic on a different day.
Gotcha.
So that we have it structured. Then that summer, they would either be in clinic, or they go on depending on the student, they're in clinic on campus, or they go on the Hearing for Humanity trip to Malawi, Africa.
Okay.
Then during their second year, they're still in classes, and then their first semester, they're in on-campus clinic again, and then that second semester is when they start to do their off-campus clinic rotations.
And what type of environments are they going to for their off-clinic rotations?
So it's a wide variety. They can go to private practices, they can go to ENT or otology offices, they can go to school districts, they can go to hospitals. So pretty much, most of the gamut of audiology aside from industry are places that I send them out to.
So you have relationships with all of those.
So we have relationships with all of those variety of places.
And I'm just curious, do you just assign, like the second year probably has no idea yet what they want to do? Like, because you can specialize in audiology. I'm a dispensing audiologist. I'm in private practice. I could also work in a hospital. I could work at the VA. I could work in the school system. I could work in an industrial environment. At the second year, they probably don't know. So how do you figure out where to send them, or do you just, the first year, it's just kind of random?
You know, some of them actually do have, some of them
Really?
come in knowing that I want to work with kids.
Okay.
Some of them come in knowing I would really prefer not to work,
with
kids,
kids.
a lot. You know, so that kind of separates
Right.
out, I'm going to send you to a children's hospital.
Yeah.
I'm not going to send you to a children's hospital.
Gotcha.
And so, you know, I
Gotcha.
do talk to, before I start sending them off campus for
Okay.
the first time, we sit down and talk for a few minutes about, you know, at least at this point in time, where do your preferences lie?
Okay.
So I do take that into mind, but then I also seek to give them a balanced input. So,
Okay.
you know, balanced schedule of rotation. So I'm not going to send one person, regardless of where their preferences are. I'm not going to send one person to all private practices and another person to all ENT offices. You know, my goal is also to make sure that everyone gets a good selection of rotation so that they can see all aspects of what audiology has to offer.
Right.
Because sometimes whatever they thought their preference was, once they are exposed to it, they think, maybe that isn't
Right.
quite where I want to end up after all.
Right,
So,
and I've had that with some of
Yeah.
the students. They're like, when I started, I really thought I wanted to do pediatrics, and now, no, not so much. We do have a question.
If I'm interested in becoming an audiologist, what's the number one recommendation for a college student?
Wow. Okay, so let me repeat that for those of you who might not have heard. The question is, for if you're interested in becoming or going into audiology and being a student, what's the number one recommendation to get accepted?
to
Yeah.
be
I'll let you, and then I'll give you my answer.
You know, I would say, first of all, I mean, try and keep your GPA up. I don't know if I have number one recommendation, but try and keep your GPA up. Do well on your GRE scores, because those are things that'll make a difference just with your application being screened. And then, you know, just get yourself as much exposure to the field of audiology as you can. So if you have opportunities to observe or, you know, things you can do at an undergraduate level, take advantage of those, absolutely. You know, be an effective communicator. You know, so if you have opportunities to practice interviewing, practice communicating, take advantage of those, because those are things that'll come into play when it's time to interview or things like that.
And I would say, and I come from a non-academic viewpoint, but I would say one obvious answer is you really have to have a passion. What's making you come into this? Because it's a lot of training. It's a lot of years of your life to go into school. If you're not loving it, if you don't have a passion for giving better hearing, if it doesn't feel really good, I would move on and do something else. I would also agree with the strong communication skills. I have students come in early on and they're so caught up in the button pushing, and in private practice, it's really more about the patient experience. I mean, there's got to be that connection, that emotional connection with the patient. And I'm like, you're going to get the button pushing down, but when you're here, I want you to, in that 30 minutes you have with the patient, we need to change their life. We need to touch them. If you did not connect with them, you wasted their time. So if you're someone who doesn't feel good about that vulnerability that you're going to have with people every day, then I would say it may not be a good fit. But if you do have it, this is a great field. It's wonderful, you know, because it's extremely rewarding, but you have to be able to have those skills and that desire, you know. So I do agree with the communication skills. I always say with some of our students, it's nice, it seems silly, but, you know, you get some of these kids who are 24, 25, and I can tell the ones who had to work, who were working retail, you know, who worked at Sonic, who was in the restaurant business. They have such stronger skills. Mm-hmm. Who knew that would have carried over? But it does carry over. They're much more confident just speaking with a stranger, you know. Some people don't have that experience, and I think it shows up a little bit.
Well, and I think gaining the more exposure, that'll come across with you knowing if you have that passion for the field, or if it's, that seemed like something that could be interesting, but I'm not totally sure.
Yeah. And I guess you wouldn't have to have that if you wanted to go into research in different areas. I am a little, again, I'm private practice oriented, so I'm trying to think of the skills that you need for this environment. But in other environments, it may not be quite as critical, you know, and you could still probably, I always say, not everyone's going to be a dispensing audiologist. It doesn't mean you're not a great audiologist. It just means, maybe this isn't your passion, or, you know, I could not work in the school system. That would not I would not shine there. So, it's good information to have. But I do think it's interesting is how they go through. They get a little exposure and they're like, oh, no, that's not for me. Or, no, I love that. I would say 1 in 8 students that I feel like should really go into private practice. I mean, that that I feel like really have that niche. We actually have one more question.
What's the difference between an audiologist and a hearing instrument specialist?
You want to answer that?
So level of training is the big difference. So as we've been discussing, the audiology students go through a 4-year clinical doctorate program. And for hearing instrument specialists, you need to have a bachelor's degree, and then you do, a small amount of training after that.
Well, in lots of states, you don't even have to have a bachelor's degree. So it's a different level of education. We were talking about the first year, second year.
Yes. Mm-hmm. So then in the 3rd year of their program, they continue to go into off-campus rotations and take their classes. Sometimes we also have developed a more advanced on-campus rotation that they come back into where they get to be, they're not as heavily supervised. They're still, of course, supervised, but it gives them that chance to be even more independent to prepare them for when they're going to be an independent audiologist.
Right. And
during that 3rd year, that's also when they start to search for their 4th year externship. And that 4th year externship is a full-time clinical rotation where they go all across the country. Some stay local, some go, literally I have them scattered across coast to coast. And they are working somewhere full-time as, an audiology extern. And that's when they really transition from, being a student to being ready to graduate as a doctor of audiology and being ready to go out and practice on their own.
So, with this program right now, what do you think are some of the challenges facing students?
One is with a 4-year graduate program, there is a lot of student loan burden that they encounter, and that's something that we are very aware of. We're very upfront with them about that.
Okay.
And encourage them, to examine what their student
loan burden. Right, because it's 4 years post-bachelor's,
right.
So it's really 8 years.
We encourage them to look at that and are upfront with them about that. And so that they can, look at the cost of tuition, look at the cost of what their loan burden will be, and make wise decisions about what they want to do in those regards. We also, we're very dynamic with our program and are very open to analyzing it, making changes as we need to, so that if there's anything we can do to reduce that loan burden, we are open to doing it.
Okay.
And then because we as a faculty are aware of that, we are very conscious to deliver them a high-quality education.
Excellent.
As a result. It's also a very, it's a very demanding program, but the students handle it, they handle it very well, and we have a very strong bunch of students each year, and so they handle it very admirably and come out very strong as a result.
I can see that. What do you think are some of the challenges facing your program?
I think we always need to be dynamic. So I think the profession of audiology is evolving in many ways, and we are open to changing our curriculum and modifying and rearranging things as we need to. While still maintaining the quality education that we provide, we are willing to make modifications and rearrangements to our curriculum as we need to make sure that we're providing the education that's needed for the changing field.
Yeah, for the current time. I will talk to students when they come in about hearing aid technology. It's like what you're learning right now will be obsolete in 2 years. So get a good foundation, learn all you can, and then when you figure out what you're going to do, you'll zone in and really specialize and get really comfortable. But
and making sure they know how to, not necessarily how to teach themselves, but know how to evaluate new things and new ideas as they come out in the future during their professional career.
Yes.
That's one thing I always like to tell them is that, I want to teach you how to learn on your own later too, because things will continue to change. So you need to be aware of that.
So we are out of time, but I did want to quickly mention one thing. I know you guys do oral rehab. Did you know we did that as well?
They mentioned that this is your oral rehab room, so yeah.
Yes, so I believe we are the only private practice that has, we call it our CHAMPS program, and we're very proud of that and we will still refer to ASU. We've always referred to ASU for that, but now we are actually able to take in some patients. So we're very proud of that because I do think it's a really important part of a successful hearing aid fittings. We had put it on hold because of staff shortages, but we value that very much. And I know ASU has a fabulous, I've had many patients go through your program, speak very highly of it.
Glad to hear that.
Yes, so I do want to make sure I give a shout out to your program for that, because those rehab, and please like and share this, I'm getting little notes held up. If you can like this event and share it, that would be so helpful. But I do want to speak to oral rehab, since mostly what we do here are hearing aid services. That oral rehab component, it just increases the overall patient satisfaction and gives people such alternative strategies, resources to be successful. And again, ASU has a fabulous program. So if you can't get to us, do reach out to ASU for that. Because, and when do you offer that?
It is on Wednesday afternoons on campus, and we've started offering off-campus classes as well that are offered at different times during the week.
Okay, so, and it's year-round?
We are not doing them during the summer currently.
Okay, perfect. So that's what I need to know. Yeah, like everything else, things kind of quiet down here. So we are out of time. It went really fast. Thank you again so much for joining us today and taking it into part of your evening. And I know you have a long commute home. I do want to again invite you all to share this event and like this event if you found it informational and valuable for you. We will be back again for our Good Sound Happy Hour in May. I believe the date is May 17th. So mark that on your calendar. Get a bottle of wine. Again, this was a Riesling. We'll also have this on our website, Facebook, so that if you enjoy a Riesling, I actually don't love Rieslings, and I could drink this. So I think it's pretty decent, but I'm not a Riesling expert. So she says it's good, so it's probably very good. So anyway, thank you all for coming. Enjoy the rest of your evening, and thank you.
You're welcome.
Thank you.
Right. 3, 2,